Hi there, it's Sarah here from BJC Health, coming to you from Sydney, Australia. Thanks for showing an interest in one of our educational events. You're about to watch part one, so enjoy the event. If you've got any questions about the content, then please consider joining BJC Connect, where you can access all of our facilitators live. Otherwise, please consider leaving a comment and we'll do our best to get back to you.
Thank you, Sarah. Hi, everybody. Nice to have you, all the friendly faces that I can see. So thank you for those of you who've got your camera on. It's always very nice. We're going to talk a little bit about supplements tonight and superfoods. I always promise this, I'm going to try not to talk too much so that there is plenty of time for questions. But as a lot of you know me, I get a little bit motor mouth, and I probably go for a little bit too long. So I'm going to try and keep it succinct tonight, because I know that this is something that people have asked me about a lot over the last 20 or so years. So what we're going to talk only about what are some of the popular supplements that get talked about in regards to arthritis, because that's probably where there's quite a bit of confusion, or we know that the research is not so great. We don't have a lot of proof of things yet. And then we'll talk a little bit about superfoods. Again, for those of you that have listened quite a lot, you would have heard me talk about this over and over, especially the anti-inflammatory Mediterranean-style diet. But I'm going to try and just bring you up to speed with what I know from research to date of what might be helpful or not from an arthritis point of view. So back when I became a dietitian, which is now pretty much 24 years ago, the popular supplements for arthritis were glucosamine and chondroitin. And I'm not going to lie in that I think back then almost every client who had arthritis was taking glucosamine or chondroitin or a combined supplement of glucosamine and chondroitin together. So glucosamine is an amino sugar that's made in the lab, so it's synthetic, but from shellfish. And so if you're allergic to shellfish, you must not take glucosamine. That's the first thing I just need to make sure, or chondroitin. There's two types. There's glucosamine sulfate and glucosamine hydrochloride. Now, research initially, we used to recommend it because we thought it was really helpful. If you're going to take a supplement, it's good to try these things for at least 3 months. That's kind of the minimum time frame to try a supplement to see if it's helpful for your symptoms, whether that is pain, stiffness, pain on waking, mobility, those types of things. So 3 months. Research to date has shown that glucosamine is not that effective, and it's definitely not as effective as we once thought when we used to recommend. Even rheumatologists at the time were recommending glucosamine and chondroitin. Rheumatologists rarely now recommend those things. In saying that, supplements is one of those things that I think if you want to try and you're okay with the investment of it, remembering that supplements are really expensive, you should try, as long as you've cleared it with your GP, cleared it with your specialist, make sure it's not contradictory to any medication you're taking. That's my second take-home message today. 3 months if you're going to try something, definitely clear it to make sure it doesn't contradict with medications, and always check the ingredients in case you are already allergic to something like shellfish or dairy or gluten, because some supplements will have these things in them. 3 very important safety take-home messages. And then if you're happy to invest, lots of clients of mine have tried things and said, look, I think it's working. Whether it's a placebo or whether it's actually working, it's hard to know, because research will tell you that glucosamine and chondroitin are not clinically effective. So if it's for you personally, great. And if it's a placebo and it's working, I've always said, great, because your aim is to try and reduce your pain. Sometimes, though, you also have to think about whether there are other changes that you're making when you've started the supplement. So often in the past, I've seen clients that they've said to me, I started chondroitin, I think it's really helping. But it just so happened that they had seen their GP or the specialist at the same time, and they reduced their soft drink intake, their alcohol intake, they reduced their sugar discretionary food intake, and they were hardly having any fast food, which they used to do before. And it's likely that the benefit was coming from the dietary changes that they were making and maybe any other medication that the GP or the rheumatologist had recommended rather than the supplement. So sometimes it's good to sometimes my recommendation is that you make your dietary and lifestyle changes first, get into good habits with those, see what they do for you in terms of symptom relief, take any medications that you need to take that have been recommended, and then try supplements. Because then you'll actually know whether the money you're spending on the supplements are worthwhile and if they're working. The other thing I often have said to clients, or they've actually said to me, let's put that in perspective, when they've finished a bottle of supplements and they've forgotten to buy another bottle, or they want to see, they actually consciously have decided to stop to see if it makes a difference. Because sometimes clients have said to me, I'm not sure if it's working, and then they'll stop taking whatever they're taking, and over the period of 2, 3, 4 weeks, where some of the effect might have come off, they'll say to me, I think that was working, but you don't always realise because these supplements are not a cure. They're not going to get rid of your arthritis. And then when they go back onto the supplements, over again 2, 3 weeks as it builds up, they find that they have improvements in their symptoms. And that's when they know it's worthwhile to continue long term. So keep that in mind as well. From a glucosamine point of view, glucosamine sulfate has got better results in research than glucosamine hydrochloride. So if you haven't tried glucosamine before and you think you want to give it a go, then the recommendation is that you take glucosamine sulfate. It seems to be more effective in slowing cartilage. And so it's particularly for people who have osteoarthritis, not so much rheumatoid. We're going to talk a little bit about both. It's more for mechanical arthritis rather than inflammatory arthritis. But just to be clear, there's no significant evidence that glucosamine is effective for arthritis. A lot of these things will be personal choice. Chondroitin is same, it's cartilage from cows, pigs and sharks, and it's a complex sugar that's produced from that cartilage. It also has had mixed pain relief in research, but mostly no clear evidence. So there might be some small gains or improvements in pain, for example, but they're not significant for most people, life-changing reduction in symptoms. And again, there's some evidence that there might be a slowing of your cartilage breakdown with chondroitin. Fish oil is something I talk about a lot because from research, fish oil is probably the one supplement, especially for inflammatory arthritis, that does have good evidence. It's really important to understand that it is the EPA and the DHA in fish oil supplements that are effective. It's not just the omega-3, it's the long-chain fatty acids called EPA and DHA, which are really important. Not linked so much to osteoarthritis. This is the link to rheumatoid arthritis, inflammatory-based arthritis. So the research tells us that you should try and get 2.7 grams of EPA and DHA a day. So I like to just say 2,700 milligrams because it's easier to work out your supplement dosages because most brands will write it down as milligrams. So let's think 2,700 milligrams is the research amount for EPA and DHA combined. So what you need to do is, if you have fish oil at home, do this after the talk, go and have a look, and somewhere on the front label of your fish oil bottle, or mostly on the back label of your fish oil, let's say it says 1,000 milligrams of fish oil. When you actually look at the EPA and DHA, I can almost guarantee you that it will be something like 120 of EPA and 80 of DHA. So out of that 1,000 milligrams, you might only have 200 of these long-chained fatty omega-3 acids that are linked to pain reduction in arthritis. So this is important because if you're trying to get 2,700, if your supplement bottle only has 200, you need to have about 12 of them to get to 2,400 milligrams a day, 13 of them if you want to get to 2,600 milligrams a day, and 14 of them if you want to get to 2,800. So we recommend you don't use the basic fish oil supplements that are 1,000 milligrams. You need to get the concentrated fish oil in capsule form, or if you want to go really easy, as soon as this research came out, there are some brands like Ethical Nutrients that brought out a concentrated liquid fish oil. 1 teaspoon gives you 2.7 grams. And the tropical flavour is pretty good, and I personally don't like the spearmint, but some people do. So 1 teaspoon gives you everything you need in the day. And that's a really easy way of doing it. There's a couple other brands that have concentrated fish oil liquid as well, where you might need 1 to 1.5 teaspoons. And then there are some concentrated fish oil capsules where you still need about 5 a day to get you to the 2,700. So it does have a link to pain reduction in inflammatory arthritis, and most of my clients have tried that over the years. One thing to be careful about is if you're on blood thinners, you can't take concentrated amounts like that. So again, please talk to your GP and your specialists. At that level, you're going to get blood thinning, and that can be contradictory for some people. Okay, something like I get asked quite a lot about green-lipped mussel and whether that's helpful for arthritis, particularly osteoarthritis. It's a shellfish from New Zealand. Studies have shown that it's better than a placebo, but again, it's low to moderate evidence that it can be helpful. If you're allergic to shellfish, please don't take this product. So if you're taking other pain relief, the evidence shows that the combination of the two might be a good combination. So if you haven't tried green-lipped mussel, then that might be something that you'd like to do. I would also recommend that you take most of these things. It's a bit of a process, but you take most of these things on their own for a little bit, even if it's just for a month. Because again, if you start taking glucosamine, chondroitin, green-lipped mussel, fish oil, and we're going to talk about turmeric, boswellia, ginger, this is a problem if you take them all at once, because if you start to feel better, you won't know which part of that concoction is actually making you feel better. It's likely that it's not going to be all of them, which means that you're investing quite a lot into something that you might not need. So little bit by little bit, and also the more that you take together, the more likely that there might be some problems in your combinations in terms of side effects. Most of these things are very safe, but there could be side effects if you're taking too much of anything all at once. Curcumin and turmeric. Now, this is one of my favourite ones to talk about because obviously you can eat turmeric. You can use ground turmeric. You can have fresh turmeric. It can go in your anti-inflammatory cooking. It adds flavour. It's an anti-inflammatory. They have so many compounds in turmeric. The active form of turmeric is curcumin, and it's the curcumin that's linked with potential pain relief in arthritis. Now, there's some evidence in osteoarthritis for curcumin/turmeric, and there's also some evidence with inflammatory arthritis. So this is something you can use in either or situation. So you can take this in supplement form or you can eat it. Most research will say 500 milligrams to 2,000 milligrams a day. About 2 level teaspoons of turmeric is about 400 milligrams. So that could also mean 2 or 3 teaspoons in your cooking. Something that's very popular is golden lattes. Like instead of having Milo, you're having turmeric in your milk. Again, personally, not something that I fare well with because I'm lactose intolerant, but you can do this with soy milk, you can do it with oat milk, almond milk, or obviously just regular milk or lactose-free milk. But I have had a lot of clients in the past that drink golden, there's different recipes. They'll either be called golden milk, golden lattes, or turmeric actually by name. But yeah, don't be surprised if you see golden kind of stuff because they like to put a nice little marketing tinge on it. But it's fresh. So you can use ground turmeric or you can use fresh. Research has shown that ground herbs and spices are just as concentrated, if not more concentrated, in all of the beautiful anti-inflammatory compounds that we want you to have. I've had lots of questions in the past where people have felt that when they use ground turmeric, it must not be as good. They should be getting the fresh turmeric, and that's not the case. You can use either or. So basically one of the things that curcumin does is that it blocks inflammatory cytokines that might be racing around your body when we have inflammatory conditions and help to reduce your CRP levels, which, of course, is one of the inflammatory markers that your GP or your rheumatologist is looking for when they're testing what's happening with your arthritis. So very promising. Something else that's quite promising is a plant called Boswellia serrata. Now, that's not something we just buy from Harris Farm, or not that I've seen, but there's some good research to show that in about 100 milligram dose, it can help to reduce pain and possibly even help with function. So this is in osteoarthritis as well as in some inflammatory arthritis. And one of the other things that has been shown to be helpful is ginger. Ginger particularly has been linked to improvement in knee osteoarthritis. And so there is a company called Fusion, Fusion, that same as the company before that put together a supplement for concentrated fish oil, that when this research came out and they actually found out that ginger, curcumin and Boswellia serrata can work very well together, they brought out a supplement called Advanced Curcumin, where they have curcumin, Boswellia serrata and ginger at the same time. And I have to say that is a supplement where I've had some very positive feedback from clients over the years where they feel it's been very successful in helping them reduce their pain levels. So if you haven't tried something like that, and again, it's cleared by your doctor, that could be something you might decide to consider, something new if you haven't tried it before. Ginger on its own, we're talking about 1 gram dose. So if you had like powdered ginger, if you have fresh ginger, I don't think there's actually just cook with it, enjoy it. There's only a certain amount of ginger you can really use in cooking before it overrides. So from a fresh point of view, you just have the dose that you enjoy in your cooking. And you could mix that with the curcumin. Curcumin is much better if you eat it with a hot meal. So if you take a supplement dose of curcumin for best absorption, please take it at dinner if you're having a hot meal, and or lunch if you're having a hot meal, and it absorbs better if you also have pepper. So crack some pepper in your food, a bit of cayenne pepper, the slightly hotter pepper, but black pepper, and have a little bit of good fats, a little bit of olive oil, and for it to be warm, the meal to be warm, and you'll actually absorb the curcumin much better, because unfortunately one of the disadvantages of curcumin is that it doesn't absorb well. So that's just a little tip. Now, the last supplement that I'm going to talk about specifically is called SAM-E, capital S, capital A, capital M, dash, little case E, which stands for S-adenosyl methionine. And basically, it's a natural compound in the body, and it has anti-inflammatory, cartilage protecting, pain relieving effects. Now, I haven't had a lot of clients try this supplement because I think it's just been growing in evidence over the years, and it hasn't been as well known as some of the others, but there is some connection. It appears that it may be helpful for people with arthritis at the dose of about 1,200 milligrams a day. So that might be something you want to go and have a look at, discover, go and ask your pharmacist about it to see whether or not that's something that you might want to try. There are a couple of brands I think it's worth mentioning, like Bioceuticals and MedLab. I don't advocate for any particular brand. I get no kickbacks. I'm not employed by any supplement companies. Supplements is something that I don't take lightly. I think when I recommend them to clients, it's because I feel it's actually going to potentially assist them, and or they've asked if they give it a go and they're really keen to try. So I'm supportive of those if it's works in with everything else that they're doing. But it's worth mentioning that Bioceuticals and MedLab are a very well-established company that educate pharmacists and health professionals about their brands. They are kept behind the counter. So when you're looking for some of these products like fish oil, if you're looking for curcumin, a lot of the arthritis-based supplements that they have, you won't just find them on the shelf. You must ask the pharmacist about it, and they will, or if you go to a Mr. Vitamins, for example, they will pull it from behind the shelf to talk to you about it, because they've been educated by the company about what the side effects are, what the doses are, who are the right people to give it a go. And it's something that a lot of clients miss because they're only looking at the ones that are on the shelf. But a very good brand. Bioceuticals was established by a gentleman that when he then sold that, he started MedLab. So their products are slightly different, but yes, a really good reputation for the quality of the supplements. So I thought it might just be worth mentioning that. Last of all, before I stop for the first lot of questions, is in addition to those supplements that I've always been asked about, they're the top ones that I'm asked about in reference to arthritis, the different types of arthritis. It is important that you have your blood work done. And if you are low in other vitamins, especially vitamin D, for example, you need to take a vitamin D supplement. Even though the evidence suggests that taking vitamin D supplements are not necessarily going to help you with your arthritis, in people who have low vitamin D, and especially chronically low vitamin D, will usually report a reduction in their pain when their vitamin D levels are corrected. and they're on supplements to help them do that, especially if it's chronically low. We don't need you standing out in the sun, in the summer sun in Australia for 3 hours trying to get your vitamin D. If it's chronically low, you need vitamin D supplements to get you back up to normal. Not only can that help potentially with arthritis, vitamin D is really essential for bone health and helping reduce the risk of osteoporosis. And it also really helps you with mood. So if you've got low mood, and especially we know when we have chronic pain, it makes it a lot harder to stay cheery. Vitamin D is known as the happy vitamin, and it's helpful for improving our mental health as well. So check your vitamin D levels, check your iron, your B12, your folate, magnesium, zinc. If any of these are low, then taking a top up with a vitamin could be really helpful in terms of your energy levels, potentially your mood. Sometimes with pain, again, not linked specifically in research, but we know this is a holistic program where you want everything to be trying to help you. So you want to find out if you've got little gaps like that you can fill. If you can correct with food, fantastic. But again, B12, iron, if they're really low, vitamin D is really low, you often need a top up with a supplement at least at first, and then you can back it up with your diet, and often it will hold at that level of correction. And if not, that sometimes just means that we're not always good at absorbing and holding on to it. And so therefore you just need to know your patterns of how much you need for the vitamin to keep you topped up. It's actually better. I've seen lots of people in the past, they go on high doses of vitamins, for example, with iron to get their iron levels up. Then it gets up and everyone goes, oh, yay, good. Okay, excellent. I can stop taking the supplement. And then they just see this decrease again and they're back down, really fatigued. And then there's dizzy, there's lots of other issues with, say, iron deficiency. And then they have to go on really big iron supplements again, which can be really bad for their gut. It's very much linked with constipation, nausea. It doesn't make you feel well. And so actually the better thing to do is to get it up and then to cut back and find out what level you need just to keep you in the right spot, so you don't have to manage the roller coaster of being really low and then being high and then being really low again. That's one of my other kind of tips around general supplements like vitamin D, iron, B12, etc. If you're a vegan and or a vegetarian not always need they usually you need B12 and vitamin D, but if you're a vegan, you definitely need both. It's just actually part of your day is to take those two supplements. And then for vegetarian, just depending on where you're at with dairy and eggs, etc., then you normally need vitamin B12 and you often also need vitamin D.
So you've just finished watching part 1 of one of our recent educational events. Hope you enjoyed the content. If you'd like to access part 2, then you need to sign up for BJC Connect. It's a free platform where you can access not just the recordings of past events, but also access a whole range of upcoming future events and access our team of facilitators live. All of the details that you need to join BJC Connect are now flashing up on your screen. But otherwise, like our staff, subscribe if you'd like to see more information from BJC Health. Look forward to seeing you in an event soon.